Okay, knock on the door, wash hands, yada yada yada. This is patient Morgan. Um, so here we go, head to toe assessment. Okay, so start feeling of the head, looking for any scrapes or bumps or lice or any bugs in the scalp. Go through the hair, make sure there's no damage around the back of the neck. Um, feel her temporal pulses, make sure they're equal. Then pull your pen light out, make sure.
I can't open my eyes.
Okay.
It's too bright.
Okay. Pupils, equal and reactive, perla. You're going to use your pen light, come around here and look in the ears, make sure there's no gunk or bugs or anything in there. Come around the other side, do the same thing to the other ear. Okay, make sure they're patent, make sure the ears have good color. And then you're going to ask her, can you please open your mouth for me? Look around, pick your tongue up, look around in there. There you go. Make sure everything's normal in there. Make sure there's no sores or cavities or spots or ulcers or anything like that. And tilt your head back so I can look in your nose. Make sure that's good. Lots of boogers in there. And you'll have that this time of year. Then you're going to come on down and check her carotid artery. Make sure that it's equal on both sides. Make sure that there's no JVD, or make sure that it has, make sure her carotid arteries are equal, make sure there's not one bounded and one not bounded, that sort of thing. And then you're going to, I want to ask you to lean forward, assessing the lung sounds. Start at the top, work your way across, deep breaths please. In a zigzag pattern, all the way around. Make sure there's no crackles, wheezes, friction rub, that sort of thing. Then you're going to come back around and I'm going to listen to her heart sounds. And this would be, you listen to the aortic valve, then you want to come over here and you listen to the pulmonic, and you come down here and listen to Erb's point, tricuspid, and then the mitral. Of course, you're listening for murmurs. You're making sure at Erb's point that you check the apical pulse. You're making sure that there's no swooshes or anything's missing as far as her systolic and diastolic and that sort of thing. Then you're going to, while she's like that, and of course all this will be under the shirt, but she's my sister, so I ain't doing that. That's kind of weird. But anyway, so lung sounds across the chest like you did in the back. And then, so again, you're listening for wheezes, friction, crackles, edema. So we checked her heart and eyes and all around her head, and now you want to go down the arm, make sure there's no swelling or redness on any part of the arm, make sure it's all normal color. She's a little pale right now. She stays in the winter time. She's weird. So that's normal for her. I'm gonna feel her brachial pulse, come down, feel her radial pulse, and then, look, there's no sores, cuts, bumps, or scrapes or anything like that. Scarring, do capillary refill, less than 3 seconds. Come around the other arm, do the same thing. Feel it, they're normal, good deal. Bam, 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 bam. Less than 3 seconds, it's good. Then, so our arms, everything else is good up top. So then let's do the stomach. Right lower quadrant. Hear anything? Normals 5 to 30. Gurgles or whatever you want to call them. So listen. You can listen up to 5 minutes if you don't hear anything in each quadrant. So bam, 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 bam. She's kind of gassy today. Trust me, I can smell it. So I assume everything's good in her lower region. So we're not going to go there. But So then come on down the legs, feel her popliteal. Of course, you'd feel her femoral artery and that sort of thing. Feel popliteal on both sides, both of them's equal. So you're still looking for scrapes and cuts and bumps and that sort of thing, scarring, edema, especially in elderly patients. You're looking for edema there. So then come on down, feel pulse, 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 pulse. Good deal. Then check cap refill on the toes. Make sure there's no ulcerations on the sore, or on the heel, sorry. On both sides. Looking at the bottom of the feet, looking at the toes, make sure they're not got the hammer toe or everything there. She does kind of have hairy legs for a woman. But then, so I'd ask her to roll over, or you can stand up in this sort of thing, So go down the back, look at her bottom, especially if you're in the hospital. You want to make sure there's no bed sores starting to form, no red areas, that sort of thing. You look on her shoulder blades too, and if they're wearing oxygen, look behind the ears for it, and underneath the nose. So everything seems to be good, and she's a pretty normal patient. I think you can tell. But, all right, thank you.